We had food permits for Quabog Valley Baptist Church and the Brookfield Food Pantry at St. Mary's. We had a residential kitchen permit is given to Epic Pastries. Dollar General got their annual food establishment permit as well as their tobacco sales permit. And Brookfield Meadows Mobile Home Park received their park permit. And for inspections, there were an inspection of the Brookfield Congregational Church, no concerns. And then Cumberland Farms Retail Food, they observed uncovered dumpster and the frequency of cleaning must be increased. That was the findings. And for reportable disease activity, we saw 14 cases of the flu and 1 case of Lyme disease.
Is this fully updated?
That's the month of December. That's what I got from, I don't have any other information.
Wasn't there like a violation and something sent out in December for a mobile home? Why is that not on
I don't know. I don't know for housing. She didn't put anything on the December report.
So if we want to know, we have to ask Michelle.
I guess so.
It used to all be on here.
Maybe she missed it. I don't know. I can't say.
The applications aren't updated either.
Free to reach out to her. Okay, the next item is the Relevant System Software as a Service Agreement. We got the feedback from KP Law's review today. Mostly looks like some typographical. They wanted to delete one statement under Section 4 fees, 4.1. Just kind of go through them real quick. Looks like mostly typos. They made another change in number 9, disclaimer of warranties regarding non-infringement of intellectual property rights. They changed the definitions under business day to Commonwealth of Massachusetts from the United States. Also made a couple more typo corrections. And
are they giving this to every town?
Yeah, everybody who's in the coalition. So mostly minor. We won't be able to vote on this tonight because this has to go back and be updated. The document that was provided to me was a PDF. I can't update the document. So we'll send this off to Lester to have relevant update accordingly the changes and then send it back to us for final review and sign off.
Do we have to sign off or do it to be a part of the coalition? And does it require any money from us?
This is the software
Yes.
we discussed. This is for the food permitting. I don't know if we have to, but if we want to use the software, we would have to sign, it's an IT agreement.
Would we be using the software at all, or would it just be the agents?
Well, we would probably get reports from it, but it's for the agents. And it doesn't cost us for the food because that was, as we talked about before, was part of the grant, is funding that.
So it would cost us for like Title V and
It would
housing
probably
and all that?
cost for that, but we're not utilizing it for those services at this point. The state is also putting together permitting software. They're delayed with their project. It's a pretty big undertaking. And so I think this is, in the interim until such time that the state provides something statewide for use.
So this is going to go back to relevant, and then is it going to go back to KP again?
No, they just gave their feedback. So, I mean, unless relevant pushes back on it.
Right, or
Then we
doesn't
would send it.
change what they're supposed to?
I don't think it changes anything. I think it was just illegal. Let's go through that one deletion.
What's currently being used?
Nothing.
It's just like paper.
It's very awkward.
It's awkward, you said?
Paper?
Yeah.
Yeah, because it's like you got to go back. I mean, it's not instant and
It's not tracked well.
trackable and following up on outstanding items. Yeah, software is actually really nice to have. So the one thing that I think is the only thing that would go to relevant, it says if client fails to make any payment when due, then in addition to any other remedies. So this is a payment language and we're not paying in this agreement. So I think they struck that. So that might be language that Leicester would have in their version, but not Brookfield.
Okay.
In any case, we have time, so we can put it on the agenda for a February meeting. I'll send it to Relevant, or send it to Michelle to give to Relevant to update, and then we can bring it back.
Okay.
Okay?
Can you put us on the emails for that with Michelle? Or is that not?
As long as we don't deliberate, there's no reason not to.
I can just forward it, yeah.
Okay.
All right, the next topic on the agenda is to set the Board of Health clerk wages. I did not partake in the selection, and I'm going to abstain from this topic as well.
Can we ask what the current rate is?
It's $24 an hour.
I thought she was going to be here. No?
I don't know.
She might be
I
upstairs
asked.
working. Are you looking for Megan?
Yeah.
She might be upstairs.
Oh.
I haven't seen her.
I thought she was going to be here. Is that a
I thought she was
conversation she'd
coming
be a
to
part
our
of?
meetings.
For wage setting? No.
No.
No. Well, plus we're giving Lester,
Right, I'm
paying
trying to
Lester.
remember what's
I
going
thought it was
for
less that we talked
administrative.
about, but, what?
I'm trying to remember what's going to Lester for the administrative.
Next fiscal year. This is
Okay.
for right now.
This is for now.
She's currently making $24 an hour in the temporary role.
And she's fine with that?
It's up to you to set the wage.
All right. I'll make a motion that we set our new clerk's wage for 24 an hour.
Is it till the end of the fiscal year? or till the end, till the new fiscal year starts. We all second that.
All in favor? Aye.
Aye.
Okay, very good. The next topic is the 2025 annual report for the Board of Health review and approval. This was provided to you at our last meeting for review, and I just need any comments, corrections, etc. Anyone that's going to be speaking at the hearing tonight, please sign in.
Do you want me to put a sign-in sheet for now up there, or no? Yes, people are looking for paper.
So we don't have to have everybody that was there in 2025 for employees for Lester?
Is there someone missing?
Well, is this for like 2025 was last year? This is a report for last year. Did Mackenzie and Shelley work there in 2025?
She did, yep.
So they're missing.
Do you want her added as the
Well, if we're
staff?
reporting 2025, we should.
Well, it's more of a meet the staff statement, but
I don't know, Kim, do you have any thoughts?
she is in here listed as a contractor.
Okay. I haven't gotten there yet.
Sorry, there's no page numbers, but it has to go into a bigger book, so.
Yeah, she's in there. Especially because, you know.
Are you asking to move it up? Do you want me to add a spot for her? And just, or thank you or something for
I think
the
it would be
first
nice.
6 months?
Yeah,
because
I mean,
she worked with residents and businesses
Okay.
and
Yeah, the other couple guys listed didn't even.
are new,
do
yeah.
anything.
Yeah.
Yeah, there's a
It's
whole
more to
blurb
introduce
in these.
people. It's more to introduce people to the staff.
Hasn't done anything.
So add Mackenzie statement. Where
Mm.
would you like me to put that? Under just the Lester and just say that, you know, we thank
Yeah.
Mackenzie for her service during the first part of the year and that she joined us as a contract
Yes.
agent?
Mm-hmm.
Okay. Okay.
need anything in here stating that, like, we've turned some things over to the select board in regards to the transfer station?
Can have that. The day-to-day management
Yeah.
of personnel. Perfect, good catch. Under the transfer station.
Was the marijuana regulation in 2024 or 2025?
2024.
Okay.
Anyone else might be speaking tonight, please sign in.
Do we need to,
A motion to approve as amended, or
do we need to do it again next month?
we have to get this in soon? I mean, I could try to,
I'll make the motion to approve it as amended,
okay.
unless,
A second.
Can you speak into the microphone?
Second.
Okay, thank you. I'll copy you when I send it.
thank you.
Any other discussion?
Nope.
All in favor?
Aye.
Aye.
Aye. All right, and the last topic before we go to the public hearing will be the review of the meeting minutes for November 19th, December 17th, and January 8th.
I don't think we're gonna get through these before.
Can we at least get the November one?
So for the part with central package, it says, ML reminded the board that,
Hold on, I gotta catch up.
second page. For their prior violation, there were multiple letters sent that which specifically reference the regulations, and that when retailers apply for permits, there's a statement above the signature where there's this blah, blah, blah. Didn't Lisa say that that was sent and she signed before the change in the regulation was even made?
Well, the 2 letters for the other violation were after the regulation went into effect. That took place in September.
They were not sent letters that there was a change in the regulation. That was her whole argument.
The letters that were sent to them had the regulation listed in the letter. That's what I said.
Okay. I don't know, I remember her not agreeing with that. I don't know if,
Well, if you want me to add a statement there, just let me know.
after where they attest that they have read both state and local regulations, maybe you could put, right before she, you could put LB,
Stated that they applied before they were in effect.
yeah.
Okay. Let me know when you're done with November.
Okay. All right, I'm done with November.
Any edits?
No, just what she said.
Okay. So do I hear a motion to approve as amended?
So moved.
Second?
All in favor?
Aye.
Aye.
Aye. So we're going to defer the December and January to our next meeting? Okay. Okay. Steve, do you have the names? Yeah, just bring that to me,
And
please.
there were a few other people that walked in that should sign it as well. If they'd like to
Thank you. Thank you. Has anyone that's looking to speak tonight not signed in? Okay. When you get a chance, can you grab that sheet for me? All right, the next topic on the agenda is the public hearing. In accordance with the provisions of General Law, Chapter 111, Section 31, the Board of Health will hold a public hearing on Wednesday, January 28th, 2026 at 7 p.m. in the banquet room of the Brookfield Town Hall located at 6 Central Street, Brookfield, Mass. 01506, to review and hear comments relative to a proposed amendment to the Board of Health regulation entitled Restricting the Sale of Tobacco Products. Proposed amendment in the draft regulation include, but are not limited to, amending restrictions on the sale of and the nicotine content of oral nicotine pouches. Any person interested or wishing to be heard on this proposed regulation should appear at the time and place designated. Do I hear a motion to open the public hearing?
I'll make a motion to open the public hearing at 7:07.
Second.
Second. All in favor?
Aye.
Aye.
Aye. Okay, I'm going to go over the ground rules for public hearing, and then I will provide a quick overview of Board of Health, background on the local tobacco regulation, background on nicotine pouches, and then we will move into the public testimony portion of the hearing. So the general rules are that each speaker will have 2 minutes to speak once. Speakers are asked to come to the seat with the microphone over here when called. Comments are relevant to tonight's proposed top amendment to the tobacco regulations. Testimony should be directed to the chair and not at others in attendance. No one should speak while an individual is providing testimony. There's no booing or clapping and things like that. The board members are not able to interact with individuals who are providing testimony. So what this means, if you have questions that you want to ask, unfortunately, we're not going to be able to interact with you during the public hearing, but we may address your questions during our deliberation. Once the hearing is closed, there will be no further public testimony allowed. So a little overview that I just want to provide before we begin. So in Massachusetts, local boards of health act as the local enforcement arm of the state's public health and environmental protection agencies with authority to develop and enforce local health regulations, conduct inspections, control disease, and address community health needs. Each local board of health is responsible for ensuring residents have access to a minimum set of public health protections, including environmental health and sanitation, housing, lodging, dwellings, food safety and establishments, disease control, inspections and permitting, emergency preparedness, and tobacco and substance use prevention. Each of the 351 cities and towns in Massachusetts operate with a degree of autonomy, or what is known as home rule, meaning specific local regulations can vary from town to town. However, all boards operate within the broader framework of the Massachusetts General Law, particularly Chapter 111, and state codes. Home rules based on the idea that local governments are best positioned to protect their residents' health. Local boards of health may adopt stricter standards when necessary to address specific risks in their communities. Public health risks can vary widely across towns due to variations in population density, environmental conditions, industrial activity, demographics, and the vulnerability of residents. The state law sets a floor, not a ceiling, for public health protections. Local governments are considered closer to the facts on the ground to make reasonable regulations that are evidence-based and narrowly tailored to protect the health of the community. And so a quick background on the local tobacco regulation. On January 6, 2025, the Massachusetts Department of Public Health, in conjunction with the Massachusetts Health Officers Association, put forth a new template for local tobacco regulations. Many towns already had enacted or updated their local regulations in 2019 after changes were made to Mass General Law related to tobacco products, including vaping. The board began its discussion of the updated template in January of 2025 and completed its review following town council input and a public hearing held in May. Brookfield's regulation went into effect in June. During this time, the town also began using MHOA to conduct tobacco inspections through a state-funded grant. Inspectors first conducted educational visits to all retail stores in town to ensure compliance with state law, including signage requirements. MHOA also conducted underage buyer compliance checks in August, which resulted in one state violation. In October of 2025, inspections were conducted by MHOA and 3 retail stores were cited. Subsequent hearings were held in November. Following these hearings, the board received a request from a resident to re-examine the regulation, and the board held a discussion specific to nicotine pouches at its December meeting. Though not legally required by the Board of Health voted to hold this public hearing to enable testimony from various stakeholders, as it has done with all prior regulations to date. So a quick background on nicotine pouches specifically. In January 2025, the FDA authorized certain nicotine pouches products for sale. New tobacco products require FDA authorization before they can be sold in the United States. Currently, only a limited number of nicotine pouches have such authorization. FDA authorization is not an approval. That means it cannot be marketed as safe or effective or as a tobacco cessation product. FDA authorized the products based on a risk assessment for adult users of these products. Available data at the time showed the probability of a lower risk to these users than cigarettes and less risk for secondhand smoke for non-users. The FDA stated that it would continue to monitor use among youth. Nicotine pouch use has increased among youth since. Massachusetts imposes additional legal requirements beyond what is required of the FDA. For example, tobacco products, including nicotine pouches that contain a characterization flavor, cannot be sold in Massachusetts even if they have FDA authorization. Okay, so the board will now hear testimony from individuals on Brookfield's local tobacco regulation as it weighs on whether to amend the regulations. The board has received several written testimonies, which I will read aloud, summarizing main points of those which may be more than 2 minutes in length. But if an individual who provided the written testimony is present tonight, the individual will be asked if they prefer to read theirs or provide testimony themselves. While this meeting is not a hybrid meeting, we did receive some requests from those with disabilities to attend remotely. I will call on those individuals and then move to call on those who indicated they would like to speak on the sign-in sheets. If you haven't signed in yet, please do so at this time, and we will begin shortly.
Before we begin, I'd like to make a statement of disclosure, please.
Okay.
Am I free to do that now?
Okay.
All right, so for purposes of disclosure, just as a Board of Health member here, I just want to state that my husband is a co-owner of Oakham Brewing Company, and Oakham Brewing Company sells beer to Central Package Store, which is a licensed retailer in Brookfield. And the matter before the board concerns tobacco sales and tobacco-related public health requirements only. The proposed regulation applies generally to the multiple retailers and does not involve alcohol sales, beer distribution, or brewery operations. So this disclosure is just for transparency only, and to let the other board members know I did reach out to ethics, received a response, and I am able to participate with the information I had provided. Thank you.
Okay, thank you. Do you have a copy of that?
Of my disclosure,
Or do you
I
have
can
the ethics?
forward it to you unless you want to make a copy of this, or here.
Just for the minutes. Okay, thanks. All right. All right, so. So the first speaker, Brad Kadelski, 15 West Brookfield Road. He is remote.
Are we doing it in order like this, or I'd like to defer for now?
Yep. I'd like to try to just keep the order.
Call in the next one, please.
Christopher Kelleher.
Yeah, I'm Christopher Keller, and I have to strongly object that people online are singled out and to be made to saying that they're requiring access due to ADA disability and they're going to be taken care of first. I think that's highly inappropriate, but if that's the way this board wants to treat the disabled or someone that participates by remote, then so be it. I want it duly noted in the minutes. Massachusetts General Law, Chapter 111, authorizes the Board of Health to make regulations, and as the chair stated, that are tailored to our town. The objective of 111 is not for local boards of health to duplicate the state law and just create all these regulations over and over. There's copy the state law word for word. The objective is for the local board to find a health risk, create a cure for that risk by creating a policy and a regulation. What concerns me is with this Board of Health is that we've seen it multiple times that out of the blue, a regulation appears and not the community nor the other two board members get to see it beforehand and we go straight to hearing. I've looked at the meeting minutes. I don't see where you guys sat and said, you know what, do you think we need to have this regulation? Do we debate it? Do we go forward? Is this something we want to explore? It always comes unilaterally, and it comes that, we just need a motion to have a hearing and to move this along. And I find that to be a defect because no other board in Brookfield does it like that. And I don't understand why that happens here. The other thing that concerns me with this regulation is that we have 4 businesses in our town that are subject to this. If you're going to change the rules of the game in the middle of the game, you have to let the people know. Every one of those people that held a permit for tobacco should have been given a notice. Hey, we're having this hearing, or hey, we created this regulation. That way they could not be in violation. This was a gotcha moment as far as I could see. And to pull people in out of their businesses and make them come to a hearing to defend themselves against something that was created out of the blue that they weren't given any notice to, I find that completely inappropriate. And I'd like to see the Board of Health do better than this. Okay? And the other thing too is we elected 3 of you to be up on that board. And I would like to see the 3 of you represent us. Not just collectively. If there's a problem in Brookfield, cure that with one regulation that is narrowly tailored, the chair's words. That's what Chapter 111 is for. Thank you.
It's time. Okay. Thank you for your comment. Sarah McColgan.
Good evening. I did submit written testimony, and if you are in receipt of that, I'd like that you read that or read excerpts from that to use my 2 minutes. Thank you.
I got a few, I don't remember seeing one with your name on it, so help me out.
It would have been from Massachusetts Health Officers Association, and it was emailed to the Board of Health and Maureen directly.
If you have it in front of you, can you read it?
I do.
I would appreciate that because I don't have a copy of it.
Okay. Dear Brookfield Board of Health, I'm writing to you on behalf of the Massachusetts Health Officers Association, known as MHOA, whose mission it is to inform, educate, and empower our members to ensure healthy communities for all residents of Massachusetts. The town of Brookfield has a memorandum of understanding with MHOA since the fall of 2024 for tobacco control to provide merchant education, retail store inspections, and underage compliance checks. Along with the services specified in the MOU, MHOA has an array of training opportunities for local Board of Health staff on tobacco and other health-related issues. As the board considers whether or not to make a revision to the current regulation of the Brookfield Board of Health restricting the sale of nicotine products, I'd like to voice my support of the existing regulation restricting the sale of oral nicotine products to adult-only retail tobacco stores. By maintaining this restriction, young people will not be exposed in the marketplace to the advertising and visual enticements of oral nicotine pouches. Barriers of access such as this restriction can help curb youth use. Nicotine impacts brain development, increases heart rates and blood pressure, and can intensify the symptoms of depression and anxiety, which many of our young people suffer from. There's anecdotal information that indicates that never before adolescent tobacco users are susceptible to these products, in part because they are often marketed like candy, they come in popular flavors, and they're far less expensive than other tobacco products because they're untaxed and they're discreet enough to use where the use of conventional tobacco products is prohibited. Schools, homes, and on athletic fields are examples of this. Oral nicotine pouches are the most commonly used tobacco product in the U.S. among middle and high school
All right.
students.
Okay, thank you, Sarah. I'm sorry your time's up. I appreciate that, though.
Thank you for the opportunity.
Brad, do you want to go or?
Yeah, I'll go ahead.
Okay,
Um,
go ahead.
so I appreciate what Sarah had to say, and there was some things learned there. Um, I think it's great. I agree. I don't want kids doing this stuff, but I think it's up to the parents to do it. The reality is most of the surrounding towns do sell these products, and the surrounding states sell these products. So I think if people are going to get their hands on these things, they're going to get their hands on them. It's the same thing with drugs and anything else. Alcohol, people are going to get their hands on it. And in regards to just my feeling in general over this regulation, I really feel that, these businesses have the right to sell these products. It's permitted in the state. And I think by us limiting 4 businesses from selling these things, not only does it impact those retailers with other products that they might sell, but I don't think it curbs the issue. And to me, I don't think the cost benefit analysis is there. That's all.
Thank you. Okay. Jake Hill for Lincoln Street Extension.
Copies, just in case my 2 minutes doesn't get done, so it's all
For all of
one
us.
for each of you. Before I begin, I just want to thank you guys for holding this meeting. I know you didn't have to, but I want to acknowledge that it shows your willingness to listen to the community voices and promotes greater transparency. As someone who does not use or promote tobacco or nicotine products, this issue for me is less about these specific regulations and more about whether stricter local rules beyond state law are truly necessary in a small town like Brookfield. While we can all find studies to support our positions, I respectfully ask the board to carefully consider how these regulations impact our residents and the 4 local businesses they directly affect, especially since no direct communication was provided to them about the changes. Although legal notification requirements were met, in a small, close-knit town like Brookfield, I believe we should also strive to do what is right by giving those affected a fair opportunity to understand and respond. While I commend the board's desire to protect children, I believe education is a far more effective approach than limiting the legal choices of adults. If protecting youth is a primary goal, I'd be happy to offer my time to help you work and develop a meaningful nicotine education program through workshops or community outreach. Finally, by restricting sales to tobacco-only stores when we have none in town, this regulation effectively functions as a local ban. And by banning the sale of certain products through this regulation that can be purchased in the next town over, you are placing local businesses at a competitive disadvantage, further straining our already limited economy without clear evidence that the benefits justify such a heavy impact. I also just want to mention two things on what you read at the beginning: minimum and floor. And these go over and above minimum and floor. So thank you for your time.
Thank you for your comment. Heather Warner. 115 Pine Street, Florence.
That's right, thanks. Good evening, my name is Heather Warner. I'm the coordinator of the Hampshire Franklin Tobacco Free Community Partnership, and we did submit a letter on behalf of the Quabog Hills Substance Use Alliance and Healthy Quabog, both of which serve Brookfield, as well as 8 community residents and 1 resident of North Brookfield. We applaud the Brookfield Board of Health for enacting these comprehensive regulations to protect teens from nicotine dependence and reducing access to tobacco and nicotine products. Easy access to these products increases the likelihood that youth will start using and become dependent on nicotine. Some newer products, such as the vapes and oral pouches, have higher levels of nicotine and use synthetic nicotine salts, which enter the bloodstream faster, increasing the likelihood of addiction. Tobacco industry understands that the developing teen brain is particularly susceptible to nicotine dependence, which is why they relentlessly market to young people with new products that evade the flavor regulations and have fewer taxes, making them more appealing and more affordable to young people. As adults in our community, we have both the ability and an obligation to make policies that keep pace with an industry business model that will always require a new generation of nicotine users. I do a lot of education in schools. I do education with parents. And I have been doing policy work in nicotine since the 1990s when I was in the Board of Health in Holyoke when we did smoke-free restaurants and bars. Everybody thought that there would be a huge harm on restaurants and bars when we went smoke-free. That wasn't the case. Policy over the years and decades that I have been doing this work, and I've seen these new products emerge, policy is the most effective route.
Thank you.
Thank you.
Okay, Shelby Hill for Lincoln Street Extension. It says maybe yes. Are you?
I'm gonna pass.
Okay. Lisa Boswell, 57 South Maple.
I'd like to thank you guys as well for giving us the opportunity to speak tonight. Just reiterating that as much education as we can provide, children are going to end up getting these products. So if we banned it here in Brookfield, they're going to go to the neighboring towns, their parents are going to have them, and they're going to get them. It's how things are. It's the way with alcohol. It's the way with the drugs. Unfortunately, yes, education is key, and providing that information, I think, is going to be the best thing for the children. But I think limiting everything completely is where it's going to hurt people who are going in to buy their pack of cigarettes, and now they have to go to the neighboring towns, and they're going to be purchasing other products at other stores, with not keeping the businesses in Brookfield thriving. And that's it. Thank you.
Thank you for your comments. And now we have Jason Boswell.
I don't really have a problem with banning them. I have a problem with how you went about it. Like, I feel like I got railroaded. I think a better way to do it is maybe put it on a ballot and let the town decide, and then enact it in the following year. Instead, like, I had a representative for the state show up and tell me I was in the wrong and selling something I shouldn't have when I asked questions at a town hall meeting saying, why doesn't Cumberland Farms have Zinn? And I was never given an answer for that. As far as banning them in Brookfield, you can go online and have them shipped to your house. So I think you're just hurting the local stores when you can still buy them online and have them shipped to town. Thank you.
Thank you. Thank you for your comment. Okay. Brian Clark, you said maybe?
Yeah.
Okay.
So, I'm Brian Clark, lived in town my whole life, member of the community. That's key here, part of the community. So, try to support local business when I can. Maybe I'm a layman, but I don't see a public health crisis here. Enacting laws on the basis of public health crisis when there clearly isn't one seems to be a little presumptuous, especially considering you're limiting the few businesses we have in town and their ability to stay afloat. So I think you should reconsider every time you come up with a law that might impact your fellow citizens, especially when there is no perceived health crisis involved in it. Thank you.
Thank you. Steve Carmen, you said maybe?
Steve Carmen. I don't have a particular interest in the regulations on tobacco in particular. It has no impact on me. However, I guess the tone of some of this public feedback does give me some insight into the concerns here. So, from my understanding, MHOA provides recommendations to the Board of Health to instill policies. And I do recall the board meeting to discuss those policies, and all three members did have some insight into this. There might have been some lack of awareness of some of the impacts of those policies, and henceforth, there's been some public input on that, and the board has reopened the public hearing to hear that, and I think that's a step in the right direction. On the meeting, there was a posting of the adjustment to the nicotine pouches to restrict it to 6 milligrams as opposed to restrict it to adult-only shops. I think that's a fairly happy medium that, upon investigation, other towns do as well. So I think what you've proposed there in your draft seems sensible to me, but I just want to make it known that my feeling toward this and toward the public that this is not the Board of Health, for my awareness, doing an assault on local businesses or health regulations. This is just the Board of Health taking input from MHOA, and many other towns are going through the same process based on this state-funded institution providing guidance to local health, public bodies to make the best decisions for the town. Thank you.
Thank you. David Fromm, 68 Fiskdale.
Good evening. I can't thank you for the hearing because a hearing should be required anytime that a community is going to be subjected to regulations. Regulations are laws, and we have to live by them. Any law should have to go to a vote, so I'm opposed to this type of regulation. I also want to point out that this comes on the heels of a long list the noisome trades, the marijuana 9-page volume, the tobacco rules. This idea that it's a tobacco-only store is a red herring. A liquor store is an adults-only store. You're trying to limit the choices of adults. And while I abhor nicotine, I do not approve of that sort of behavior. And I must point out that it is a recurring theme with this board. And I will close by suggesting in a helpful way that you may consider the agenda that's put forward seems to always come from the top. And why is the top always the same? You've had 4 years of the same chairman. In this town, tradition and practice is to rotate. Do the other members, I wonder, Ms. Chair, have no desire to experience leadership? They were elected to be our representatives and our servants. I would suggest that we consider reorganizing the board to try to get fresh perspectives once in a while. I think that might be a good start. Thank you.
Thank you. Eric Clark? Or is it Eric? Okay. And David Holcraft? 26 Allen?
Dave Holcraft, 26 Allen Road. Thank you to the Health Board for having this meeting. I think people are talking about the Health Board. I think this Health Board is more active than the ones in the past, and they're bringing things forward. We're having more accountability from the Health Board, which is good, and they're letting the people know what's going on in our town, and I think it's very good. As far as the Zing, either way, but what the Health Board is doing here tonight is letting people be aware of what's going on as far as health issues. In the past, the Health Board was not that active. As far as they're bringing all sorts of stuff forward to the townspeople, and you all are being aware of what's going on. And I think in the past, the people didn't even know what was going on in the Health Board. Now we do. And I think it's very good that we have a Health Board structured like this. And we have 3 members involved, and I think we got to continue that. Now, one other question I have to the board, which you may not answer, but you all voted against this before, and now you're not. One member, Christine, is not for this now. She's for the Zing, and the other 2 members, they all voted not to allow Zing, and now it's a 2-to-1. I don't know how it's going to vote, but that's come about, and I don't know if there's something going on behind the scenes or not, but it is being brought forward, and that's something that is troubling me. So I think we should thank the Health Board for the hard work that they're doing in our town, and they're making things aware so you people can come forward like we are tonight, and I think that's very good. Thank you.
Thank you. Anyone want to speak that has not spoken or signed in? Okay. I'm going to read some of the written and received. We received a letter in support of restricting oral nicotine pouches to adult-only retail establishments. This was from a Massachusetts youth fighting the tobacco and vaping industries organization. Looks like they are a statewide initiative that focuses on engaging young people in local change efforts to protect communities from the influences of the tobacco industry and to raise awareness on how the industry targets youth. They go on about the nicotine pouches having a significant impact on young people because they release nicotine without smoke, making them seem safer, even though they cause the same addiction that cigarettes cause. They talk about Zyn specifically, about being able to be tucked inside the mouth for an extended period of time without creating smoke or smell, making them easier to hide. These tactics increase the risk of youth addiction and make it more important to keep them in adult-only retail spaces. And then they close with restricting oral nicotine pouches also supports broader public health goals. Early exposure and nicotine increases the likelihood of long-term addiction and can negatively affect brain development in adolescence. And so they claim that limiting access, the policy helps prevent normalization of nicotine use and reduces the risk that young people will experiment or become dependent on these products. So that was signed by a statewide leadership for the 84 movement. There's about 20 different names. These are not, this particular letter did not come from anyone within Brookfield. So these are many towns around Massachusetts, but not locally here. So you guys have a copy of that. We received a letter from a person named Anna Pereira, did not give an address. It says, good evening, members of the Brookfield Board. Thanking for opportunity to speak. It says, my name is Anna Pereira. I'm a junior at Everett High School, so again, not Brookfield. Here as a youth advocate and someone who sees firsthand how big tobacco and nicotine companies continue to target young people, especially with products like oral nicotine pouches. I'm part of the 84 movement. So another 84 movement person, a youth-led anti-tobacco movement working across Massachusetts to end nicotine addiction in our generation. She's also a youth advocate with TISA, Teens in Everett Against Substance Abuse, where she works directly with students who want to advocate against nicotine and big tobacco companies. She says nicotine addiction doesn't start by accident. It starts because big tobacco designs products to hook young people early. She believes that oral nicotine pouches are not clean or safe. They come in sweet flavors and high nicotine levels and are also discreet, again, so they can hide them. She says she's watched her peers spend 20 minutes in school bathrooms so they can smoke or use nicotine and cannabis products, and that the habit has been normalized among them. She says that normalization is dangerous because when something feels normal, it stops feeling harmful. She says these companies have a long history of lying to protect profit, and when cigarettes became regulated, they pivoted. So when vaping faced pushback, they pivoted again, and now they're pushing oral nicotine pouches. So she believes it's exploitation, and that the proposed amendment is not about punishment but protection. So that's the basic statement from her. Heather, this was your letter. I'm not going to read it, but several members of Brookfield did sign the letter. Sherry Jepson Zitter, 149 Lake Road. Forrest Jepson Zitter, also 149 Lake Road. Michelle Clark, Rudy Heller, 8 Central Street. Dr. Gwendolyn Brose of 144 Rice Corner Road. Sawyer Blake, who is from the Town of Ware, Project Community Coordinator. Rebecca Edwards for Quabog Hill Substance Use Alliance, Town of Ware. Jerry Gray, 22 Lane 21, Brookfield resident. Hannah Gray, 22 Lane 21, Brookfield resident. Jane Gray, 24 Lane 21, Brookfield resident. And then a Suzanne Y. Lewandowski, Master of Education, North Brookfield resident, founder of North Brookfield Cares to Help. So just to document that those were the people that signed the letter. Heather had already provided testimony, so we're not going to reread that. And then we got a letter from Tobacco Free Mass, from Elisa Phillips. This is also advocating for policies and regulations aimed at protecting young people from becoming addicted to tobacco and nicotine products, including one of the latest products, the oral nicotine pouch. They say the use is growing rapidly among the youth and policies are needed to curb their use, increasing and strengthening local policies that reduce access to tobacco products is a public health strategy that can reduce the risk of early initiation and addiction and safeguard the health and well-being of young people. It says that nicotine goes in just about, what nicotine pouches are, and that research demonstrates that nicotine is uniquely harmful to young people. Young and youth and young adults are more susceptible to nicotine addiction, and nicotine can harm brain development. And then just saying that in Massachusetts, local communities have been proactive in advocating for and adopting evidence-based tobacco control policies that prevent young people from becoming addicted to tobacco products. Local health boards have been successful in preventing youth access and exposure to tobacco products through policies, including preventing tobacco sales near schools, reducing access to cheap cigars, limiting youth people's exposure to tobacco products, and removing tobacco products from sale in pharmacies. These efforts have been instrumental in reducing youth tobacco initiation and youth rates in the Commonwealth. So that's that letter. And this was different, and okay. And I think that was all we had for the written testimony. So we've covered, this is Jake's, we've covered the people on the line, we've covered people in the room. We have.
Can I reclaim the last 30 seconds just to say one thing?
We're only letting people speak once, I'm sorry. Okay. We will keep your letter, though, with us when we deliver it. Okay. Okay, so with that said, we have some people that just joined us. Anyone here wanting to speak? Come on up. Please state your name and address, and then, or any organization you may be from, and you'll have 2 minutes to speak.
My name is Anna Pereira. I'm from Everett, Massachusetts.
We just read your letter. Oh, I'm going to let you speak, though, because you're a high school student. Yes.
Yeah. I live on 46 Bernal Street in Everett. Yeah. Good evening, members of the Brookfield Board of Health. Thank you for giving me this opportunity to speak. I know I came in late, but my name is Anna. I'm a junior at Everett High School. And I'm here as a youth advocate and someone who sees firsthand how big tobacco and nicotine companies target youth, especially with products like nicotine pouches. I'm part of the 84 movement, statewide leadership team, and I'm part of a chapter. It's called TISA, Teens in Everett Against Substance Abuse. It's a youth-led anti-tobacco movement that works across Massachusetts to try and limit how much youth smoke. Mm-hmm. Try to end nicotine addiction in our generation. I'm also, I work directly with TISA. I work directly with students who want to advocate against nicotine and big tobacco companies. Nicotine addiction doesn't start by accident. It starts because big tobacco designs products to hook young people early. Oral nicotine pouches are not clean or safe. These pouches come in sweet flavors, higher nicotine levels, and are discreet, so kids can hide them from parents and teachers. These companies know exactly what they're doing. I've watched my peers spend 20 minutes in school bathrooms so they can smoke or use nicotine and cannabis products. And what's worse is that this habit has been normalized. This normalization is dangerous because when something feels normal, it stops feeling harmful. These companies have a long history of lying to protect profit. When cigarettes became regulated, they pivoted. When vaping faced pushback, they pivoted again. Now they're pushing oral nicotine products. This isn't innovation, it's exploitation. The proposed amendment...
Sorry, I have to cut you off. I'm sorry. It's 2 minutes, but thank you so much for your comments.
Thank you.
Taken into consideration.
If she wants to finish, I give her a minute of my time, because I'm only going to take 30 seconds if you want.
Is that allowed?
No, we're going to try to refrain from that, but come on up, Jake.
Jake Hill, 4 Lincoln Street Extension. Amazing that you come out from Everett for that. Thank you so much. While we might have difference of opinion, I just want to reiterate that 90% of the complaints sounded like it was about kids and nicotine. And this is an ID'd sold product. And I think that's very important to consider when you guys consider these regulations about not limiting what adults can choose to do. Again, just want to say I don't promote it, don't use it, nothing like that. For me, it's about leaving choice in people's hands. And again, my offer is out there. If you want to develop an education program for the kids with nicotine, I'd be glad to work with you guys on that.
Okay, thank you.
Yep.
All right, we're just going to let anyone else. Any final? I don't know why it's not showing. Just giving an opportunity. Yep, okay, come on up. State your name and address.
My name's Leah, 135 Town Farm Road. I want to thank everybody.
Leah, I'm sorry, last
Leah
name?
Moreau. Sorry, yeah. who spoke and who came. I don't think that anybody is for children using substances, tobacco, alcohol, and despite our best intentions, regardless of the regulations that we put into place, most of the time, they're going to find their way to whatever those things are. And I think we need to be really careful what the citizens of the town are speaking versus what other organizations are promoting to the town. We are a small town, and there isn't always a black and white, and I think that that needs to be treated as such. And we need to be really careful what kind of regulations that we put into place that affect local businesses, because we don't have a lot of them in town. I have a farm, I have a local business in town, and I have to deal with a lot of regulation, and we need to be mindful, are we passing regulation because we are responding to something, or are we just being progressive and doing it when we are passing regulation that is unnecessary and it can inadvertently affect our citizens of this town? So we need to be really careful. These things can be the best intentions, but it doesn't mean that it's the right course of action to take. And there's always an alternative route. Jake mentioned community education, outreach programs. It doesn't always have to be passed on to the business owner that has to take the biggest hit and be affected, because it really makes an impact. And when we make decisions like this, we need to think it through, and how does it impact our local business? So I think that with that, that's all I have.
Thank you. Anytime. All right, last call for comments. Okay, thank you very much for your comments. Do I hear a motion to close the hearing?
I'll make a motion to close the hearing at 7:52, I think.
Second?
51.
51. All in favor?
Aye.
Aye.
Aye. Okay, the public hearing is now closed, and the board will go into deliberation. There'll be no further comment from this point. All right. Copy of the regulations. I'll let you guys speak, so I did not propose this, so.
All right, well, I guess I can start. So we did bring this back up because I do feel like there was a lack of awareness to the effects of what we actually voted on for our local businesses. I was not comfortable at all how it was handled and how we entrusted you to relay this information clearly to these businesses, and it just hasn't felt right. So that is why it was brought back up. And I gotta say that the people that showed tonight and spoke were majority town residents that were not for as we had made the reg. I was looking back at our notes. We had a checklist here for policy decisions, and I circled what we said as we were going through, and we said no to, well, we left oral nicotine patches open, and in my notes, I made a note that we were going to leave that for the public hearing, and then no one showed to the original public hearing. And then I was under the impression I may have misunderstood what 21 plus meant. I was thinking liquor store, you have to be 21 to go in there and purchase things. But I really, in my head, thought we voted on the size, and that was not the case. And then when these violations came about, again, with them not being all made aware, that's why I wanted to revisit this. So that is definitely one. And then there was another one I circled no, and that's not what our reg is. Ban redemption of coupons, we said no. I don't know, I guess those are the two that really stuck out that I don't feel what we had talked about aligned with what we actually changed the reg to, so. That's all I have to say for now.
So our proposed amendment that we have on the floor is section G for the oral nicotine pouches.
Well, it's not subject just to that.
Is there anything else that we wanted to address?
I like my color copy better, hold on.
I think, like, from feedback that I've heard is that the no more than 5 sales permits is too restrictive, and that we're not going to allow any new businesses in town. I don't know if we want to consider increasing that number. I don't know what the right number would be.
What page are you on?
This is page 9, under number 10, 10A.
Well, I've heard many people say we're a very small town.
Right,
So how densely do we want?
right.
I mean, we only have 4 now. That leaves 1 additional. And then, of course, in the regulation, if people are adversely affected, they can always appeal to the board to have a variance, right?
So does this mean 5 active?
Permits.
Not like, oh, there was a business and they closed.
Right.
And then a new business wants to come in and open.
That's my understanding.
Okay. At any given time, there should be no more than 5.
Would you want to move it up to 6?
I mean, I don't know.
It's leaving it there. It's not saying that we're even going to get another business that wants to come in and do it, but
Right.
like you said, if there is.
I would be fine changing it to 6 to give a little more wiggle room, I guess, because there's already 4. But at the same time, then it makes it more competitive for
I
our
know.
businesses that we have in town. So if we want our businesses that we have to be getting the business,
I know.
it's opening it up. It's like, I don't know. We can revisit that if we want to. But I think the biggest thing was section G.
Yeah, so do we have to pick one or the other, or no, right? We can just have nothing there, or?
I think the template basically offered both. I thought at our last meeting or the meeting in December that Kim said that there was a limit on milligram from the state.
That's what the language said in the template.
Yes, this is the original. There was an option for either restricting to adult only
Right.
Or there was language that said, no retailer or person shall sell or distribute or cause to be sold or distributed oral nicotine pouches with a nicotine content greater than 6 milligram per individual pouch.
I didn't do any further research on them. I don't know anything about the milligrams of the pouches, to be honest. That's pretty standard.
Can I ask a question to somebody? It's a quick yes or no.
No, the public hearing is closed. We're in deliberation. It's us.
So
We
you
can
don't-
always, we
So
can
I'm
always
gonna ask you
extend, we
then?
can
Can I ask
always
you?
extend. Yeah, you can.
Do you know what the current milligrams from the state is?
I don't know about the state, but I haven't looked recently from the FDA, but the last time I looked, the FDA, there was only up to 6 milligrams approved products. So, I mean, again, we're restricted to, no one can sell a product that's
Right.
not on the FDA's website. They may have updated it though, so I can't speak for it. I don't know why we,
So do we
I
have
mean-
to really have a number and a restriction in here if the FDA and the state law already has something, is what I'm getting at.
wouldn't it help to have people know? I mean, if, for educational purposes, for people to know
Well,
what,
if it's not legal to sell, then you can't get the product to sell it in a store.
you may be able to. I'm going to try to look up what Massachusetts state law is.
Right, just reference state law. I mean,
For
section,
vapes, it's 35 milligrams per milliliter.
We're not talking,
I know what we're talking about.
no, I'm just trying to focus on what I'm typing, sorry. It has to be so-
read, Christina, read
Yep.
section S.
Yeah, so I think we can just take it out because it says
Yep.
that. It says, "The sale or distribution of tobacco products as defined herein must comply with state statutes, including but not limited to those provisions found in the law." So I'm gonna, unless do you want to talk about it anymore? Anybody?
I'm good with the language that's proposed. I don't see what I'm trying to understand what the public health perspective and it's over the town business part, like what middle ground or,
Well, the middle ground is we have to follow the state law, so, and there's laws
yeah.
to
What-
protect kids and allow for adults.
Well, I will say, we did have
choices.
one violation of somebody selling to a minor. So it's not that it's not going to happen. It has happened and it can
Exactly,
happen.
same thing with kids are gonna go buy it wherever.
Yeah, I mean, I'm
It's-
just saying
we
the
can
date,
only educate the best, it's up to people
I'm
to
just
make the
saying
choices.
the data that we have, I'm just going by the data that we have. We have one violation. It's new, I don't know what the next year would look like. I don't know what
Did
this.
we ever have anybody going around before? Like,
No,
okay, so we don't really have much data.
could have been, yeah, it could have been great or it could have been terrible. I don't know. I don't have that data point. I only have that one data point,
Yeah, okay.
which is why I would be hesitant to change it, but if you change it, then why
I
not
guess
just
we can
put
always
the,
revisit it again, just like we are now, right?
yeah.
But for now, based on what we've heard by our residents, I'm going to make a motion that we remove section G on oral nicotine pouches. Or we leave section G, oral nicotine pouches, and then put under there, refer to section S. If you'd like to change the wording or anything, I'm open to that.
What's specific about the wording that troubles you?
I just don't want to go above what the state law already has in place.
I'm fine with section G referencing section S.
So are you seconding that?
Yes, second.
Do you have specific language?
Yep. So just remove what we have and put, please refer, or don't put please, just put refer to section S, page 11. Well, I don't know what page it's going to be now that we take out whatever, but. Or you can just copy the whole statement.
It's got to
and
be
put it there.
exact, so I just need to know exactly what to put in the document.
What would you like exact in there, Kim?
Section S1.
Okay. Refer to section
That's
S1.
that whole sentence.
What about number 2?
That one too.
So it's just section S.
Yeah.
Yeah. Because it could be something that like changes. It could constantly change. So
Yeah.
if we just reference state law, then
Yeah, these are always going to constantly
It's-
change. The state could come out tomorrow and just ban them.
right.
And then we'll
Then
be-
it
And this is all for nothing.
covers it.
Yep.
completely.
Okay. Do we take a vote?
How do you vote?
All in favor?
Oh,
Aye. What do you mean?
No,
How do you
I'm,
vote?
like, I'm asking you how you want to, I'm asking you for your vote.
Aye.
Okay.
Aye.
I will abstain.
Okay. So the cigar sales,
Which section?
it's right under the oral nicotine on page 9. I only have, I believe, did you give us the actual, oh, right here.
What's the alternate language?
I don't know. I don't really know.
I don't have it.
It looks like we just picked what they recommended. No one talked about it. It looks like just some certain brands are no longer able to be sold, but I don't know.
Well, from what I heard, it's like
The point of the regulating the
Old men.
minimum,
wanting one cigar.
it's been,
Now they're-
no, there's data that shows, and it was in the template that referred to a footnote that children have been targeted because of the cheap price, and that the tobacco industry had, by way of the placement, by way of the pricing, there was like, I don't know, it's like social media, TikTok videos, people trying to make it look cool to smoke a cigar, and so they got a lot of kids. Previously, there's data showing that kids have gotten hooked on tobacco
we were
through the
able to
use of
buy it.
cheap, huh?
Kids can't buy them.
Well, they get them all the time, I guess. I don't know. I mean, if you ask anyone who's addicted to tobacco, most of them are going to tell you that they started taking it when they were a kid,
I know.
not when they were an adult.
I was a former high school health teacher.
I did have a conversation, like I said, with the vice principal at Tantascwa. They called it she called it a pandemic.
Yeah.
She referred to, though, they're using apps, they're using social media to kind of get around the rules on advertising. I mean, that's basically the MO of that industry, but
I don't disagree on that.
that's the rationale for the minimum price.
I'm trying to pull up. Each.
While you're doing that, I just want to say, I don't unilaterally or propose regulations because they are, my personal agenda or anything that I'm trying to do in town. I'm doing it because even though there's been some that I don't agree with at all, but just because the state puts in front of me a template, I'm not going to not put it forward to the board. So I brought everything to the board. I brought it in January of last year. It was on our agenda in January, February, March, April, May, and in June. Each board member needs to do research, read, understand what they're discussing, and do the work, 'cause I can't do any of that for other people.
Showed up to the public
Well,
hearing.
there's
is the
that too.
problem.
I mean, it
We have
happens.
No public input to go
I know,
off of.
I know we
And
did.
And now we have
I'm in
it,
the
so
same
that's what
boat.
we're going
I'm
off
in the
of.
same boat. It's not I think all three of us were in the same boat. We're
Why
trying
was
to,
the trash hauler reg pushed off
are
till
you recused
further?
from that or still, or?
I'm asking a question
What?
that you can answer. Why wasn't a public hearing set for that yet, and why have you deferred that?
We had a public hearing for trash hauler.
Why did we pass anything?
haven't been able to pass it.
Why has it been deferred, and deferred, and deferred?
It's been not a vote because we can't agree and we have to rewrite it so that she doesn't want to approve it.
Okay. Okay.
Haven't got there yet.
Okay, Maureen.
Okay, Christina.
All right, there
was no alternate language in it. It was
for
just
the
section
cigar?
H. It's either you leave it there or you take it out, I think. It was green.
Yeah, the whole entire section, I know, right?
The problem is we get something from the state, and we're a very small town. We're not like every town.
That's where I'm at.
To permit, we need regulations at the local level.
I understand.
Mhm.
But
I mean,
it
it's
doesn't
just
need to
part of
be
it.
restrictive.
Yeah, I mean, I have skin in any of this.
I
I
know.
don't smoke, I don't have a business. I'm going with what input I get. I'm just doing the work of putting it together.
Okay, well, maybe for the cigar regulation section, what do you think about just referring to section S?
I'm fine with that.
Same thing with the section L with the coupon pricing. We can just refer to section S.
Coupon is a state law.
Yeah, I know. So what's in green that we changed or added? So
I think it's just stayed. It's in the current, right?
The only other thing I can see that's like a all-out ban is section K of the prohibition of sale of blunt wraps in Brookfield. That's not a state law. If we're gonna
Over
go
200
with
towns have banned
state
them.
law,
well, I'm worried about Brookfield, not every other town, so I'm going to make a motion that.
Do you know what a blunt wrap is?
Yeah, I do. Do
Can you
you?
explain?
Oh, do your research. I've done mine.
Yeah, I know what it
So,
is.
okay, we're good, then we're on the same page.
Can
So, I am gonna make a motion that we remove section K.
I'll second that.
And then I'm going to make a motion for section.
You didn't vote.
Oh, okay. Aye.
Aye.
Abstain.
All right, and so for section H and section L, I would like to defer to section S under both of those.
Defer or refer?
Refer. And eliminate what we have in there.
Sorry, did you make a motion?
Yeah.
Oh, second.
Any further discussion?
No.
All in favor?
Aye.
Aye.
Abstain.
I think that's all I have.
I just, in regards to education, on MH, MAHB. There is education pamphlets they have stickers, they have all these different things that you can order for free. They were out of certain things that I thought would like probably target like our teen audience better. I was gonna order some, I got distracted and I didn't, but there is free resources out there that you can order right off their website and they'll ship it right to you. I just want to put that out there.
Cool, thank you.
mahb.org.
And the effective date?
One second.
Are we going to do today?
It's got to go to the state. Usually, what, about a month?
Did we make a total ban on flavored tobacco products in here?
State law says you have a ban on flavored tobacco products.
Okay.
Yeah. So you said it has to go to the state?
Well, I have to submit, yeah, anything that, I mean, I just have to mail it, and then we have to sign it, but I have to update this document before you can sign it.
So can we do it before our February meeting?
You want to schedule another meeting?
No, but we have one in February. Can we get it on the agenda?
Yeah. So we'll
I
target,
don't know what the date
I
is.
think it's like the 28th. How about we just target a date of
25th?
March 1st so that it's a nice clean date, and then we'll have it on the agenda in the February meeting,
Okay. To sign?
which would be the final vote approval, and
so-
I'll make the updates.
Yeah, March 1st.
To vote and to approve changes. Okay, anything else?
Nope.
No.
Motion to adjourn.
Make a motion that we adjourn at 8:21.
Second?
Second. All in favor?
Aye.
Aye.